Welcome back, everyone. This is your host, Arushi. Thank you for showing support to my first video. Keep showing the love and subscribe to my channel. And before we move on to today's episode, I wanted to re-emphasize that this channel is for anyone and everyone who wants to understand how to navigate the healthcare system to stay healthy in a pocket-friendly manner. All right, as I promised you in the last episode, I have with me Dr. Jeffrey Millstein today, who will share his perspectives on why there's delay in primary care and give us some useful tips to avoid delays in seeking appointment with primary care doctors.
Okay, so let me start first with giving a little introduction on you, which is
Sure.
you have been currently an attending internal medicine physician at UPenn Hospital. So I would like to get a little bit history on you, how you got into this role, and what has your journey been like?
Oh, sure. Well, I'm trained as an internist. Now I practice really just outpatient primary
Okay.
care medicine. So I don't do any hospital work anymore. And I, for many years, was just doing completely clinical practice without any other activities. And I guess probably in the last 15 years or so, I've gradually become more involved in teaching students, writing, and I have a new role, I guess, that I've been in for about 3 years now as a medical director for part of
Mhm.
the primary care network at Penn. So in that role, I've gotten involved in trying to improve practice workflows and really just trying to make our practices more accessible and that such that they give a better experience both to patients and to the clinicians and the staff. What a
Yeah.
neat role. It was like a little out of my comfort zone when I started in it, but I really love it a lot because I think it's given me an opportunity to try to make medicine better in a way that is really important for people and for both clinicians and patients alike. Really.
No, that's a commendable task that you have taken up on yourself, and I'm hoping that there are more people who can do so. Um, so then moving on to the topic that I'm trying to highlight and help people with is there are delays in getting primary care,
Yeah.
period. Has been going on for a while. Do you see it improving in the near term, or what are the challenges if you don't see it improving in the near term? What's causing it and keeping people from
Mhm.
um, getting the right care soon?
Yeah, it's a great question. And honestly, I think access to care is really the issue right now in healthcare. We have so many wonderful services that we can provide to folks in both in primary and in specialty care, but the challenge is getting in the door. You know, so I don't really see that changing quickly. Because I think the healthcare system is reconfiguring itself very gradually. So I don't think that there's going to be a quick solution to to the access problem. The I think they're really in my mind. I'm thinking of three general categories of
Hmm.
why there is an access problem in primary care, but I think this probably extends to other specialties too. But one is that we just have a smaller workforce because folks have left primary care. Many physicians have retired and probably some even earlier than they expected to. And I think that was catalyzed really by the pandemic. I think that got folks out of clinical medicine a little sooner than expected. And of course, there was a lot of frustration and burnout already, but that was also, I think, accelerated by the pandemic, which also caused a lot of attrition from the clinical workforce. So that's part of the reason for the decrease in workforce. But the other is that we haven't been replenishing the workforce as well as we would like to. So medical students are not choosing primary care as often as they're choosing other specialties, which they may view as having more prestige and higher income earning potential and such. So that we have to we have to find a way to kind of get the pipeline of new graduates up to speed for us. So a shrinking workforce is one of the issues. The other is primary care clinicians are not seeing as many patients as we used to. And I think a lot of that is fueled by some changes in the insurance industry with this ushering in of value-based care, which is really a good system in many ways. I mean, it's an attempt to reimburse clinicians more for outcomes and for achieving certain metrics of quality. Things like making sure patients are seen regularly or are getting their mammograms and colon screenings done and things of that nature. But what's happened is that the value-based care has generated a tremendous amount of asynchronous task work. So there's a lot of work to do in addition to just interacting with the patient. And it's become overwhelming. And I think, honestly, it's probably one of the most significant sources of clinician burnout. So what's happened in reaction to that is many physicians have reduced their hours, have extended the duration of their visits. They've tried to find ways to build in time to get that work done, that non-face-to-face work, and it's really reduced our availability to see patients. And there also are issues too with the way visits are prioritized, like the visits that capture these metrics that are reimbursable are of course going to increase in priority, and that makes it more difficult for folks with just ordinary concerns or any concern really to get in. If they are due, say, for an annual wellness visit, they may not have as much difficulty getting in because that captures a checkbox or a metric that we get paid for. But an ordinary complaint is lower on the priority list. So that's the second really big category. And then the third one, I think, is really just that there's an increased demand for care. We have an aging population. We have more complex, nuanced illnesses and things that need treatment. And then we have this surge in interest in preventive care. So, we have all this population health sort of outreach to people, proactive outreach to try to get people to do the things that they should do to keep healthy.
Okay. Well,
so those three categories are really the things that are causing the access problem, I think, in general.
So now that there is shortage and delay, and you have highlighted different aspects of why that is happening, access is the issue. What are the ways in your experience that, be it a young person or an aging elderly person or urban versus rural patient, how can they work around this access issue and get the right care in the meantime when the system is still reconfiguring?
Sure. I guess I could just say just very quickly that I do absolutely agree that improving pay for primary care doctors and improving the quality of life for them is an important part of kind of revving up the pipeline interest in primary care. Absolutely no question. I'm not familiar, I guess, with any specific kind of initiatives. I know, some medical schools are offering, reduced or free tuition to folks who commit to primary. But yeah, I do think things like that will help, but in terms of what can folks do to help navigate the crazy system, I think there are a lot of things that there are a lot of practical things. I guess I always like to try to find some optimistic pathway in this, because it's very easy to get dragged down into the quicksand of negativity. And that's not going to really help anyone. Yes, it's a
Sure.
very challenging system, but yeah, there definitely are things we can do to help. I think having an advocate is a huge help.
Okay.
I mean, I have a lot of folks who've made this comment that, boy, it really helps to have a doctor friend. And that is definitely true. It's a very, very helpful to kind of have a connection to someone who has, whether it's a physician or not, someone who has some knowledge of the healthcare system to
Hmm.
help help you a little bit. But no, not everyone can have that person in their life. But in terms of how folks interact with their clinical practices, I think there definitely are some tips I could share about that.
Uh-huh. Sure.
One, I think, is to just acknowledge the fact that there's a lot more group practice these days and very team oriented constructs to the way primary care medical practices work. It's not like the old days where you just had maybe one doctor who you would always get directly to respond to everything. There's a team, and I try to encourage my own patients really to get to know other doctors or other clinicians in the practice,
Hmm.
so that if I'm not available, they don't necessarily have to see a stranger. They could see someone who they've met before, who kind of knows their history. And so taking advantage of the fact that there are multiple clinicians in the practices is one way to help navigate the system. The other thing is, many practices, including ours, we have a lot of advanced practice provider clinicians. So we have nurse practitioners and physician assistants who are absolutely instrumental parts of the workforce. That we could not meet the needs of our population nearly without our advanced practice providers. And they're excellent clinicians. And we, like many other practices, we view them as partners, as colleagues, and embracing that is really important in achieving good access to care. If you're absolutely strict about seeing a physician for everything, it'll be much more difficult to get in the door, because the fact is that nurse practitioners and PAs are part of the workforce. That's probably not going to go away, and we rely on them and we trust them, and they're very, very competent practitioners of primary care. In most cases, they do practice with some supervision and partnership with doctors. So it's not like there's just no other oversight. It's a
Hmm.
team. So that, just embracing that is super important, and just really learning how to interact with your practice as a team is
Hmm.
super helpful. For instance, you know, understand how the triage works in your office. So when you call the office, try to learn who is it that you're talking to. Is it a scheduler? Is there like a
Hmm.
nurse triage system? Many practices have a really robust nurse workforce who have the first touch point with patients to try to figure out, like, how can this person's needs best be met? Whereas maybe in the past, it was just sort of a knee-jerk automatic, oh, you have an issue,
Hmm.
come on in.
Correct.
It doesn't work that way as much anymore. I think we try to figure out, all right, what really requires an office visit? What might we manage virtually? What might we manage over the phone? Is there another component of our system that might address this person's needs? So getting to know the triage system is really, really helpful, and how best to reach them. Use technology to your advantage. I know in our office, as much as we've tried, the
Hmm.
phone is still a very
Yeah.
difficult. Um, the online portal is much better. And I always try to counsel my patients, hey, if you don't have to be a computer expert, but if
Hmm.
you can get on the portal, boy, you'll have a much easier time interacting with us.
And then
Uh,
even with elderly patient that works, um, most of the times, are you able to convince
it
them to jump
actually
ships?
It actually does. I mean, look, there definitely are some who just haven't mastered it, and we try to find workarounds for them. Uh, but I always encourage elderly folks, if they have a an advocate, family member, or friend who is more
Mhm.
comfortable with technology, to partner with them a little bit. That's helpful. And a couple other things would be to make a make a habit of scheduling your next visit at the time of your current visit. That way you don't have to worry about having to make an appointment and being told there aren't any. And then trying to learn a little bit about whether your practice has any sort of walk-in hours, or is there a way to get in for same day or next day care that you may not even be aware of? So for instance, in our practice, we have slots that are blocked for same day or next day care, but you have to understand that in order to get one, it's best to probably call right when the office opens.
And is there a criteria for that? Is it a walk-in or same-day appointment just limited for severe, like serious cases by any chance?
Not necessarily. I mean, generally the same day or next day, or we do kind of triage them to see if there's a true priority need, because we don't have a lot of same day or next day slots. But at least knowing that they exist is important for
Mhm.
folks. And we don't have walk-in hours per se, but many practices do.
Okay.
So really, I guess in a nutshell, really understanding how your practice works and how you can make the most of it.
Well, thank you for giving all of those suggestions. I'm definitely gonna, with my primary care, looking for a walk-in in case I need one in the near future. You highlighted broad areas how patients can overcome some of these delays. I'm also really curious from my end if there are like rural pockets within a city or even rural areas, if you would have some insight into how those folks could um, get access to primary care, because there are other barriers I'm sure at play.
Oh gosh,
And
yes.
yeah.
There are. I mean, yes, there are some other, and I guess I should have mentioned, there are other barriers that are much more difficult, uh, namely areas where there just aren't enough practices.
Mhm.
So that's really part of the workforce problem. Is it's not just that we don't have enough clinicians; they're not distributed in an equitable way. So that is
Right.
a big problem. And I think health systems are I think trying to find ways to address that,
Mhm.
by trying to open up clinics and offices in places where they're most needed. Um, but it's it's a tough hill to climb there. I mean, I think probably reaching out to the hospital that's near you is probably a good place to start, because usually the hospital is aware of where the clinics and resources are, and can
Mhm.
sort of um, help you find care. Many hospitals have community health workers that they partner with, who can serve as advocates or liaisons to folks who are struggling to find care,
Okay.
and can help folks learn how to use other places, things like virtual care, or other
Mhm.
clinics that are maybe not connected to a health system too. Uh,
Yeah, I know that's a big challenge. So, but
it's a
I'm
huge challenge. Yeah.
yeah, grateful for you to share some suggestions for those patients. So I know that primary care is burdened with lots of patients wanting to get care.
Mhm.
Would you suggest that patients can get themselves aware of when to use primary care or seek primary care versus going to an urgent care or a retail clinic?
Yeah, I think that's a really important, that's an important thing to be tuned into. I think if you have complex chronic illness, then you really are best served, I think, by a primary care clinician. And I do think that older patients are also really, I think, best served by having a connection to a continuity primary care practice. There certainly are things that folks can handle in retail clinics or urgent cares very, very well. Things like minor upper respiratory tract symptoms or sprains and strains, lacerations. Urgent care has really unburdened, uh, you know, folks from having to wait for hours and hours and hours in an ER to take care of, relatively minor problems. Things that might keep you in the ER for hours can sometimes be managed very efficiently in an urgent care setting. And young, healthy folks without chronic illness can probably get many of their needs met in those settings. And yeah, they definitely are a big part of helping to improve access to primary care overall. Yeah, but yeah, but they can't really replace continuity primary care practices. And yeah, if you are older or have complex illness and things, chronic illness, definitely a continuity practice is your best bet.
So for a demographic like mine, who's like fairly healthy
Mhm.
adult, um, what would be a usual frequency of touching base with your primary care in a year that you would recommend?
Mhm.
And then on the side pairing, if need be, urgent care, for just like the same day, visit.
Well, I think probably a yearly check-in with primary care would be reasonable. And the reason for that is really just as a touch point for making sure you're up to date with health
Mhm.
maintenance and prevention. And it doesn't necessarily have to be an in-person visit. It should be some kind of touch point where you review your vaccination status on things, your compliance with the basic preventive measures for your age group and stuff. One of the things that I wrote about recently was just that, one of the things that constrains access to care is that we are a little too insistent, I think, sometimes on having folks come in person to the office for well visits, because most of what we do in a well visit doesn't really require face-to-face contact. And uh, I think we have to probably be a little more discriminating in terms of what we insist that people come in person for, because there just isn't enough capacity to see everybody in person every year and then still have enough visits for people who have concerns that come up. But so I guess the way I would leave it is that it's probably good to have a touch point with your
Mhm.
primary practice once a year to make sure you're up to date on health maintenance and prevention.
Do you ever get pushbacks from patients about like, hey, if primary care is about like that long-term relationship with your physician, so
Mm-hmm.
I would love to be in person and have like, get checked by the doctor and all versus telehealth. Is there a
Yes.
pushback to an extent and by patients, and then how you work around it, or how you convince them that maybe telehealth could be a way forward, or in some, yeah.
Yeah, I think a lot of it distills down to effective communication and managing expectations. When a patient comes to the practice, I think it's important that we help them understand how the practice functions and what we usually bring into the office and what we may use telehealth for and such. And patients also can choose. Now there are some, I think, financial barriers to choice, but there are practices that are kind of designed for folks who may want more of a continuous in-person connection with a clinician. That practices that are larger and like multifaceted may not be able to really afford to do. Like, so for instance, there are these practices that are like concierge model practices where the clinicians have much smaller patient panels and have much better access to care. And the way they are able to afford to do that is by charging a premium to have access to the practice. It can be anywhere from a few hundred to a few $1,000s a year to be able to have that sort of easier access. Now, that's not something that everyone can do, but if you do have the means to do that, and you want to just have more access, personal access to a clinician, that's one way to do it. There are different levels of that. I mean, concierge medicine usually refers to like a much higher price tag, but there are other types of practice models where physicians and other clinicians have smaller panels, and there's a more nominal kind of fee to be part of that group.
And then the fee is separate than what patient generally pays for their insurance premium, right?
Right. There's still the practice will still bill the insurance most of the time. The one exception being something called direct primary care, where these primary care practices really don't use insurance at all. They have a model that's based totally on an upfront fee per month to provide primary care services, and it does not involve billing insurance. And many clinicians like that because they feel as though they can escape the frustration of dealing with insurance companies, which is very challenging sometimes. So there are lots of. It's good to know, I guess, that there are a lot of practice models out there to choose from. I mean, it's just unfortunate that not everybody has all those choices. And I guess whenever I mention this, I always feel sad in the sense that I know that there are so many patients out there in areas where they're lucky they can find any primary care contact.
True. Very true indeed. Well, on that note, since we in our conversation in the last question touched a little bit on telehealth, I would like to explore that area more and ask you about would a wider telehealth adoption and use of at-home devices, digital devices, help the primary care practice maintain that continuum of care, the longitudinal care for their patients?
Absolutely, definitely. I think telemedicine has tremendous potential. So, I mean, it's realized a lot of its potential already, and that was really catalyzed by the pandemic. But yeah, I mean, telemedicine is really extraordinary what we're able to do, and what we can do in the future even more so by making use of wearable devices and other ways of getting data, clinical data from patients without having them standing right next to us. It's great, and practices use telehealth in many really interesting ways. Some practices have sort of what they call a virtual first model, where your first contact with the practice is always a virtual contact, and then they start there, and then depending on what the issue is, they will escalate to in-person care or other forms of care depending on the need. So that's a model that's become very popular. But no matter how it's used, there's no question that telemedicine can extend our reach to patients, and it's probably going to become even more so in the future, I think. The other thing with telemedicine is, sort of like everything else, there's definitely an access barrier that's based more on socioeconomic or social factors, and broadband access is not as uniform as really it should be. And
Agree. Agree.
I mean, it's almost gotten to the point now where I have a colleague at Penn who framed this so beautifully that broadband access is actually now really a social determinant of health, just
Yeah,
like food insecurity and other things, you know. So we have to address that too.
totally agreed. And it's not just in, again, rural parts, the pockets in urban areas and cities where what we could label as food deserts, they're not just food deserts, they also have, dearth of, as you may say,
Yes.
like proper broadband.
Yeah.
So yeah, that's very unfortunate, and I wish that at some point those things are starting to be worked out, be it through the government, private sector, or combination of both, or even like nonprofit. Um,
Yeah.
yeah. So with that, I think we're at the end of our interview here, so to speak. So I thank you once again, Dr. Millstein, for coming today, giving all your insights from years and years of expertise in primary care.
That's all for today, folks. In the next episode, I will talk about things to keep in mind during open enrollment season that will help you maximize on your insurance plan. And again, please share your thoughts and feedback in the comment section below. Until next time, stay tuned and take care.